Hi you guys, it's me, I am here with another video. So you guys, I know you guys are wondering what has been going on with the NCLEX, what's happening, how did it go? Did you pass? Did you fail? Those of you guys who follow me on Instagram already know the outcome, but I'm here to tell the rest of you guys who don't know officially that I did officially pass the NCLEX-RN on my first try. I am officially Adam Price, RN. It is so surreal to me that I am utterly done. It's like all these tasks have had to be fulfilled before I'm able to move on. But it's amazing to say that I am actually done. I am a registered nurse, and there's nothing else I have to do. I am a registered nurse. I've been practicing as a registered nurse now for about just over a month now. It took me a while to come and make a video because it just still did not sink in that I had passed the NCLEX. So, and then I'm an RN all the way from CNA to LPN to now RN, and it's just surreal to me that this is true. I mean, it's just crazy. So it's amazing. So this video, one purpose is to tell you guys what did I do to prepare for my NCLEX. Well, you guys, I did read a lot of my Sylvester book, the one I showed you guys in my last video. I read a bit of that, and I especially brushed up on the OB, pediatric stuff that I felt weak in. And I really loved the book. It just went through and it just outlined everything perfectly so you could really understand what you were studying, what is important about this or that disease process, or what's important about the whatever topic that is being discussed. It was really a good book. I also used Kaplan. I went through and did most of the questions that you do on the people that purchase the Kaplan or is doing the Kaplan inside of a nursing program. If you purchase the Kaplan, there's like 8 test trainers, and I did up to 6. I didn't do all of them, and there was one big one that was like 265 questions that I did not make it to. I just couldn't find the amount of time to sit and do that whole test, so I did not do that particular one. But for the most part, I did Kaplan. I did a little bit of ATI. There are video modules in ATI that were really helpful to me. I can't remember how I got to them, but they talked about like chest tubes and different kind of suction yonkers and different kind of signs, just a lot of stuff. If you're a visual learner, they have like a lot of video seminar kind of type things for you to watch, and that helped me a lot because sometimes I'm visual, and I'm a really visual learner, so I have to see things, so that was really good. And that's all I did. I got my ATT about maybe a week or 2 after I made my last video, and I scheduled my test fairly soon. And what made me schedule it very soon was a lot of my classmates had been taking the NCLEX and had passed, and I kind of categorize myself with those people, were their grades better than mine or worse than mine? So I was like, well, if their grades were worse than mine and they passed, so I probably need to go ahead and take the NCLEX and just get rid of this anxiety. So that's exactly what I did. The NCLEX was very difficult. It was a very difficult test. I would like to retract the statement that I said in my last video. I talked about how I did not like Kaplan, but I can honestly say that those questions were formatted almost exactly the way those Kaplan trainers had been formatted, like almost exactly. So ultimately, Kaplan is probably the best study tool that I used. I had several select all that apply. I had one dosage calculation, which I got wrong because I went back and did it. I got it wrong. Did not have a lot of pharmacology, had a few OB, Had none of the drag and drop, just most all, select all that apply, and just in a lot of therapy. What is the most therapeutic thing for you to say, or how would you respond to this patient? A lot of that. During the NCLEX, I was so nervous. The security, the guys who are doing it through Pearson View, which I guess everybody's doing it through Pearson View, the security is heavy. So I would advise you, don't take anything with you. Don't even take a watch. Don't take a necklace. Don't, just take you and your ID, because anything else is just going to be more hassle, and it's going to make you more stressed out because you have to put stuff in lockers. And so just don't take anything. Just take you, your ID. That's it. That's it. Like, seriously. That's what I mean. I didn't take any. I left my cell phone in the car, but I wore a watch. So they was like, take your watch off, take your necklace off. I'm just like, oh my God. So if you can, I would not take anything with you. Just leave it all in the car. It would decrease your stress level tremendously. And security is very tight. Like, it is very tight. So there's no way you can cheat. But my experience for testing was very pleasant. You know, I felt like, you know, it was very quiet in the room. The temperature was fine, so I was very comfortable. It's just that my nerves were so all over the place. I was so nervous. But other than that, you know, the test went well for the most part. After I finished, I seriously, and it's so different because I remember you guys, me talking with my LPN video, I remember saying that when I finished my LPN NCLEX, I kind of knew that I passed. Something about my LPN NCLEX, I just knew it. Like, I don't know. With my RN, I seriously thought I had fouled it up bad. I thought like, okay, yep, I'm done. I failed. Because and this is something else that I wish they would not have did, was told us how the test works. I wish they would not have explained to us how the adaptive thing works, because all during the test I'm thinking about not the question, but I'm thinking about, is this question harder or is it easier? Am I doing well or am I doing bad? That's what I was thinking about the whole entire time. So I wish they would not have ever told us how the test worked, because that had me so totally distracted. I mean, I got my results. Well, I didn't even do the quick result thing because my license posted less than 48 hours after I finished testing. It was active on the Board of Nursing website, so I didn't even pay for the quick results via, you know, through Pearson View or whatever that is. I didn't pay for that. My license was active very shortly. It cut off at 75 questions. Thank God. I don't think I could have dealt with much more. My heart was pounding so bad, like, oh my gosh, like, I could just hear, it was just, I was just like, oh my God, I'm about to have an anxiety attack. But other than that, I'm glad it's over. I'm glad it's done. I am a registered nurse. Oh my God. Can you guys, I like for real, like for real, seriously, I'm a registered fucking nurse, and those of you guys who have been with me through LPN, the program, then NCLEX, and then RN program, the NCLEX, knows how much of a monumental moment this is for me and for anybody. That's it, you guys. I don't even know what else, I'm done. Like, I was thinking, like, I am gonna go get my BSN, yes. But I don't even know how I would vlog about that. Like, how do you talk about, because it's so different from what I'm understanding. It's so different from my program. So how would you even vlog about getting your BSN from RN? So I don't know. But I'll keep you guys updated. This is amazing. I feel like it's a journey coming to an end, because with LPN, I knew I was going back to do the RN, and there's so many different, you know, levels of nursing and ranks of nursing that you can go through. I just don't know. Next, BSN, MSN, and maybe even your DNP. We'll see. If you guys are not following me on Instagram, please go and follow me on Instagram at Adam Dashawn, ADAMDASHAWN, to keep you guys posted and updated. I'll be making videos, but I don't know what I'll be talking about. Probably all the crap I used to talk about before I got in nursing school. um, that's it, you guys. I love you. I would like to Nurse V. She had Thank you for your support, Nurse V. Congratulations to Kirsten Smith, all of my other people that have followed me on Facebook and Instagram, and who have been who have subscribed to me on YouTube. Thank you guys. I love you all. You guys have no idea how much support that you guys have offered me, because this is a journey for anybody to go through. It's so difficult, and I thank you all. Again, guys, if you have questions about the NCLEX, hit me up down here below, or just direct DM me on Instagram, and I'll answer the questions. I know you're technically not supposed to talk about the NCLEX, but you're not supposed to talk about, by law, you're not supposed to talk about the NCLEX, but I might have a small little channel. It's not like I'm promoting anything. So if you guys have questions, I love you all. It's over. I am Adam Price, RN. I'm done. I love you guys. Thank you guys so much. And I'll see you guys on the next flip flop. Bye.